We're going to go ahead and get started on the topic for today. So, hi, everybody. Welcome to our PTTU video series. Today, we're going to be talking about having a relationship first approach and using that also in your clinical engagement for both your patients and your offices. So, I have a couple little ideas that I wrote about and kind of weave together that hopefully will provide some value for any of our therapists that are working on continuing to build their caseload and build their referral partners. So I wanted today to kind of be a little bit thought provoking, organized, but still thought provoking, and trying to figure out like how do you generate good conversation without it starting with, "Hey, how was your day?" Because I think we can really quickly and easily run into that "How was your day?" topic and work down that rabbit hole of like, "All right, well, I see you're busy today. I'm going to be talking about X, Y, and Z." Versus engaging with people as if, you're super focused on the actual companionship aspect to your relationship instead. So, when you're engaging with your referral sources and your clinical partners, whether that be home care agencies or DME companies, or really anybody in the community that you're utilizing at that aspect, we try to avoid leading with a sales driven mindset. I think it's really easy to think, well, I've got a mission here. My mission is to get patients. So I really have to lead with content and talk about my practice in order to really hit it home and create a good synergy with whatever potential referral partner that is to try to get patients. However, when we focus instead on building things from more of an authentic aspect and going in and really getting them to try to get to know you as well as you really trying to get to know them, your partnerships are going to become more meaningful because they're developed through more thoughtful conversation, curiosity, and listening instead of just immediately presenting services. So every time you go in to build a relationship, try to be really keen on asking intentional, more open ended questions rather than yes and no, because that's going to encourage people to step outside of their routine thinking and reflect a little bit more deeply on their patient's needs. So I like to really think like, how can I create space for dialogue rather than just delivering a monologue? And sometimes it has to start with a little bit of a monologue to get to the dialogue. But a couple of examples I wrote down are, if you were going into this would be more of an office-based example, but are any of your patients currently dealing with or experiencing any type of challenges or pain or mobility limitations that you're concerned about? If anyone in the office is managing a complex case like this, I'm always happy to collaborate or offer some level of recommendation. I like the word collaborate a lot. I think it's super smart just because you're positioning yourself rather than, and I like the word resource too. It's great to be a resource, but here you're positioning yourself both as a resource, also as a trusted colleague of someone that's trying to deal with a case that might not be their run of the mill balance case. Maybe they're presenting like they potentially have vertigo, for example, and they don't have vertigo. Or maybe the doctor just heard the word vestibular therapy and thinks now every patient that needs balance has some type of vestibular dysfunction, which is not always the case. So I always really try to encourage my offices to use myself and our therapists as a resource instead of just, okay, well, I'm going to send the orders out. And when they kind of are encouraged to view you that way, you're viewed more like an accessible clinical partner, almost like the personal therapist for their patients, like you want to be positioned rather than just another service provider, someone that's coming in to kind of give a spiel. And in this same line of work and the topic of like building connections and relationships and trying to be a good educator for the offices, a part of this too is like addressing the reality of what home therapy and what the environment at this 2026 what the state of affairs really looks like. So it's really important to acknowledge like the broader challenges that are currently within our landscape of healthcare. I think everybody can relate to it on some degree that the system in place has just become more and more increasingly constrained and in many ways like antiquated in the structure of how we can provide the care that we've always known we've been able to provide to patients, which just in the more recent years has become more and more challenging to really get out to there. In this way, patients are often discharged sooner than they were in the past, whether it's due to reimbursement changes or pressures or just regulatory changes. And this accelerated discharge timeline can also leave patients vulnerable and at higher risk to functional decline, falls, injuries, rehospitalizations, medication mismanagement, I mean, you name it. By recognizing the like systemic limitations, you can really frame our services as a proactive solution, which ding ding, we've always wanted to be proactive, yet it sometimes feels like we're always providing care that is reactive, a status post fall instead of patient has imbalance. I'd like to address that now before they have the fall and kind of getting to the root cause of why it is these patients are kind of dealing with these repeated injuries and things that are going on that potentially could have been prevented if we can continue to remind our doctors that we're here to kind of be an extra spoke on the wheel, but to get them to think about care differently and do the things that they've always wanted to do without necessarily running to MRIs and imaging and giving patients answers that may not even be needed in order to really help them or heal them. Of course, there's a place for all of the imaging and that kind of thing and specialists and such. But if you can frame your services more proactively as a solution that the patient might not need to go through all these hoops, because a lot of the times they end up back in our care anyways once they've done all of that because now they have answers, but they still need solutions. We can continue to support the patient to get to where they should have been the whole time by maybe just cutting in and trying PT first. So by doing this, you're supporting the continuity of care for patients, you're reducing risk for them, and often really like bridging the gap between what's happening with these shortened home health episodes. So always like I wanted today's major takeaway to just be always listening before advising and really ask questions that provoke some type of reflection. Position yourself as a trusted clinical partner because you are. You're not just another company that's walking in, you're walking in as the expert in our field. And they're really not getting to see a lot of PTs and OTs walking into their facilities, into their offices, and into their spaces. So when they're seeing you not like a vendor, but as an extension of their care team, then collaborating with you feels more natural. And they're going to call you and kind of ask you things. Hey, perfect example. I had a doctor call me today. Do any of your therapists do aquatic therapy? And of course, it's like, oh no, none of the therapists really want to do aquatic therapy. But tell me a little bit more about this case. Why did this patient want aquatic therapy? They heard it from a neighbor that it's really good because they have joint pain, so they keep having falls. And it's like, well, if the patient's having falls, it sounds like therapy on land is going to be a lot more effective than putting them in the water because every case is going to present differently. But why don't we just try an eval first and get an idea of what this patient's limitations are and go from there? And maybe we can give them a program that if they have a pool and they just enjoy exercising and swimming, maybe we can show them a couple of things that they can do in the pool, wearing weighted ankle weights or whatever the case is, but kind of giving them something to do on their own that maybe they wouldn't do their normal home exercise program because they feel scared that they're going to fall. But maybe that gets them moving in the right direction. So there's always ways that you can like naturally provide an extension of care and improve patient outcomes as a result of that without coming off like you're always delivering monologues or scripts, which I think that's really the challenge in this mindset of being a therapist and trying to market yourself. You're having this like role identity shift where you're really focused on being the clinician and then you're going in, you're like, well, how do I tell them all I want to do is take care of people? Just remember, these things. You're a highly trained movement specialist. Doctors, although they have a degree of understanding how to potentially diagnose or write a script to order therapy, they aren't equipped with the same level of knowledge that you have. And so by walking in and kind of like assuming that role and having confidence, of course, not arrogance, but confidence in what you do, a lot of these providers are really going to they appreciate that because they don't have the time to deeply assess functional decline. They just clock in, they recognize it in that 15-minute visit. And then that's our expertise to really decide what are we going to do with that functional decline and how are we going to push that patient into the next phase of getting better. So I kind of just wrote this as a last little quote, cap for today. But when providers see you as their mobility expert, their problem solver, and extension of their care, referrals follow naturally and they don't feel forced. So hopefully this little bit of feedback helps and continue to provide all of the information that you do. Don't be scared to, continue to listen more than you speak, but also provide good feedback on cases because the doctors then too are going to recognize that and send you more patients because they feel like they have a relationship with you over having just information on a piece of paper from a faxed eval. So thank you.